Thank you, Julie, for the introduction, and thank you, Kevin, as well, for introducing this research and making the space to share this work. As you say, it's not something to shy away from, but something that we do need to lean into. So I'm a researcher from the Transdisciplinary Psychedelic Research Group at Exeter University in the UK, and I study normality challenging experiences, such as psychedelic experiences. And I'm interested in their different sides, both positive and negative. In my work, I try to balance polarizing narratives. So what led me on this path? So many of you will be familiar with Michael Pollan's 2018 book, How to Change Your Mind, which has been instrumental for popularizing psychedelics, now also a Netflix show. Like many, I started from a very enthusiastic perspective for the potential of psychedelics. But soon I came to see their darker side, their potential to also deeply harm. And things are changing a lot in the last few years, perhaps an inevitable backlash to a blind psychedelic evangelism. We're seeing more of the harms coming to the foreground, and Power Trip Cover Story is a good example, a podcast that exposed the darkest corners of the psychedelic renaissance through the intersection of mind, body, and control. And then recent media on the sad death of Matthew Perry, who drowned under the influence of ketamine. Or Joseph Emerson, the pilot who was still hallucinating 48 hours after taking magic mushrooms and tried to crash the plane in efforts to wake up from a dream. So we have seen the waves of research focusing on whether psychedelics are therapeutic and their potential in treating various mental health disorders. But now, again, for good reason, more are needing to face the question, are psychedelics harmful? What's hard to deny from either side is that psychedelics are powerful substances. So through my journey, I have found myself looking from both lenses, and I became concerned about the lack of balance in public narratives and how this can harm people. Luckily, others shared these concerns. I am part of the Challenging Psychedelic Experiences project, which was launched in 2022 and includes psychologists, philosophers, therapists, and journalists from around the world. The aim of the project is to address an important research gap in the field by researching extended post-trip difficulties and what helps people manage them. So I joined the team as a research fellow, and this is the work that I'm sharing with you today. So why is this project needed? Speaking from recent data, 9% of psychonauts experience difficulties that last longer than a day. 12% of people who take ayahuasca require psychological assistance to deal with the difficulties that arise from their experiences. More than half of the Canadian psychedelic survey participants struggled with a challenging trip, and 45% of them thought that no good had come out of it. So, acute challenging experiences may be therapeutically meaningful, but to ignore harms undermines the validity of the research and increases the likelihood of backlash. So the first project study was a survey of 608 people who experienced difficulties lasting longer than a day. And the first paper reporting the nature of these difficulties, led by Jules Evans, was published in October 2023. So looking at the duration of our participants' difficulties, a third of participants struggled for more than a year, and many actually suffered more than 3 years later. So we let people describe their difficulties in their own words, which included anxiety and fear, including fear of permanent damage, social anxiety, panic, paranoia, feeling traumatized by the trip. We also saw experiences of existential struggle that we're going to go more in depth soon. And then derealization, feeling that the world around you is not real. Depersonalization, a sense of detachment from yourself. Social disconnection. and visual distortions, hallucinations, as well as many other kinds of difficulties. These are just the top 6. And also to note that, of course, these percentages represent proportions of our sample of people that experience these difficulties, so may not show us how common they are among psychedelic users more generally. But let's look through the words of our participants. For about 18 months, I awoke with the sun every morning, full of a feeling of absolute terror. Sometimes my anxiety would be so high in the morning that I would physically shake from the energy. Most days, I would sit in disorientation and deeply saddened by my existence, which progressed into an existential crisis. The questioning of the whole universe. Why are we here? What is the point of this? Another says, I entered the experience believing it's the literal, real, external world. It was so bizarre and dreamlike, I could not make sense. These memories left a legacy of confusion about what deeper model of reality to use, and repeated experiences of flipping between these models at different times. I had what I afterwards understood was a severe panic attack and went to the emergency room with an ambulance. After this incident, I have had heavily dissociative and surrealistic feelings all day, every day. I still experience these issues daily, and it's been almost 2.5 years since it happened. I spent a long time looking at myself in the mirror, feeling like my soul was missing, like I was a hollow shell of myself, and like I had already died. I felt very disconnected from everything and everyone around me. The trip was the most powerful experience of my life, starting off well, but turning into a roller coaster of intense feelings of panic and loss of control. I felt completely destroyed and terrified for weeks after, and with no one around me that I could relate to about it all. So what might make such extended difficulties more likely? 40% of respondents in our survey thought that an incident of childhood trauma might be related to their difficulties. Almost a third had a prior psychiatric diagnosis. And then there's the factor of AIDS at the time of the trip. Are young people more vulnerable? Is it a matter of prior life experience? A few studies suggest so, with a recent interview study by Rebecca Bremler and her colleagues also showing evidence for this. And then there's the complex factors of before and after, lack of preparation, lack of integration support. There's no consensus, although bad trips, we have to say, still occurred in facilitated sessions and clinical trials, so it's not a matter of an ideal setting, and we don't really know enough about integration and preparation, but we do agree that they're important factors. And then there is the social environment that someone returns to. Feeling alone, that no one else has been through such an experience, that no one would understand. So I want to ask a question to everyone in the room, asking for a friend. Please raise your hand if you or someone you know have experienced difficulties after a trip, let's say that lasted longer than a day. Thank you. So the next question we explored was then, what helps people manage these difficulties? And the second project paper reported on this based on the answers of the same 608 respondents, and it's been released as a preprint available since January this year. So what did our findings tell us? Firstly, helpful support from others. So that would be support from close others, talking therapy, support from a guide, or from their community. Then cognitive self-care, which included meditation, prayer, surrender and acceptance, as well as strategies like cognitive distancing, focusing, framing, and reframing. Then embodied practices included exercise, movement, and somatic practices, emotional freedom technique, tapping that was self-done, and breathing practices. Then meaning making, which involved self-education through reading, journaling, and writing, as well as creative strategies. And then some people were helped by pharmacological means, some found help with medication, some turned to alcohol to cope and other recreational drugs, or found that a new abstinence from them actually helped them. But some did find that further psychedelic journeys was what they needed. So it's safe to say that there is no size fits all in this. Some found some practices are and support helpful, like meditation or joining groups, while others found the same practices unhelpful. One example to consider here is that when people reached out for support from others, whether it was family, therapist, a shaman, they reported that they found it unhelpful as often as helpful. Why is that? So they said that they felt that others either dismissed or invalidated their problems. They felt they were over-medicalizing in the response, so pushing labels of psychiatric diagnosis, or over-spiritualizing. You just need to listen to the medicine. And just a note on balance here, participants were asked if they still take psychedelic drugs. More than half of them said yes. They were then asked to rate their agreement with this statement. I believe that the insights and healings from psychedelics, when taken in a supportive setting, are worth the risks involved. Over 80% of our participants actually either agreed or strongly agreed with this statement. And that's within a sample of people that experienced difficulties that lasted over a day. But there is still a lot more work to be done, because as we saw, many suffered for years. And we need to understand and reduce the risk of this suffering. We need to be aware of the full range of possible outcomes, inform people about them, find out what helps people cope with them, and share stories to help people realize it's not just them, that there is a way through. And because there are post-trip difficulties that can feel very isolating, we did a follow-up interview study for a particular psychedelic difficulty, dealing with ontological shock and existential distress. So there is a lot of talk in the field about the therapeutic role of mystical experiences and the shifts in people's worldviews. These narratives frame mystical experiences as positive or even as the mechanism of therapeutic change. But what happens when a mystical experience leads to distress? If the shift in worldview actually brings more confusion rather than a new enthusiasm for life? Our participants went through sometimes dramatic worldview shifts. One shifted after a phase of intense psychedelic exploration from an atheist dominatrix to a trainee Buddhist nun. Another shifted from a US Air Force clerk to a member of a channeling community. But these transitions were sometimes bewildering to go through. So we asked these participants about the experience of their trip first. People had ontologically challenging experiences that included mystical and religious experiences, terrifying ego dissolution, experiences of insight and gnosis, feeling like a higher truth is being revealed to you, extrasensory perception like telepathy, and out-of-body experiences, as well as time travel and bodily transformations. So these were often accompanied by feelings of confusion and fear, with interviewees describing feeling paranoid and unsafe. And this often related to existential concerns, a fear of death, fear of insanity, fear that the experience will never end. So people often emerged with a greater sense of existential confusion and ontological shock. What is real? How do I make sense of this? This was followed by persisting emotional difficulties like heightened anxiety, a few describing they wanted to crawl out of their own skin, as well as social difficulties, which included both a fear of being alone, as well as struggling to interact with others at the same time. And they had other cognitive, behavioral, and somatic problems, not being able to focus or work anymore, struggling to sleep, or being tortured by nightmares. So what was a common thread in participants' difficulties was a sustained destabilization of their sense of reality. The psychedelic experience, says this participant, was so powerful that it fundamentally challenged my perception of reality and how well I could trust my perceptions in the day-to-day. I could never really trust my sense of what's actually going on. And then others felt overwhelmed and sometimes obsessively preoccupied with making sense of their experience. I wanted to understand existence somehow, and I knew I couldn't. In this DMT high, you feel like you can understand more things. And then you come back and you're like, what the heck? This wanting to understand the meaning of it all, or the universe or existence, and then just not being able to take no for an answer. So what did our participants find helpful then? Firstly, there was the element of grounding. That was a big one. Almost all participants mentioned that they were helped by grounding practices. And also to note, almost half of the interview participants explicitly stated that their trip was traumatic, and more than half reported symptoms of PTSD. This participant says, I felt as if I was kind of outside my body. So I did things like the stretching, yoga, and then trauma release exercises. That's where you get your body into a state where your legs shake, and that's for releasing trauma. It was like, there's trauma in my body, and I've got to get rid of it. I've got to shake. I've got to get this stuff out of my body. And then things like walking barefoot. Luckily, this participant knew about grounding. And then the cognitive normalization helped them, which involved finding frameworks to understand the experience and practices such as acceptance, distancing, or reframing the experience as an inner state rather than a realization of a cosmic fact. What I saw on my trip was just that. The quality of my trip, the quality of my mind, and how it was determining the quality of my life. The trip showed me in what direction my mind was pointed. That helped me strip this sense of objectiveness from my experience and allowed me to connect with the sense that what I experienced was not true objectively, it was simply true and relevant to me. And that definitely helped stabilize me a lot. Then social normalization involves speaking to others who have had psychedelic experiences and related challenges, sharing their experience with loved ones, connecting with a community that understands their experience and accepts them. The value of such interpersonal support was mentioned by almost all participants. Just having someone say that it's just like a normal thing that happens. I remember it being really reassuring, and just knowing that it was okay, that someone else had been there and had some nice advice. So, reflecting on our data, maybe we can make some tentative suggestions for how to manage the implications of ontological shock. In terms of preparation, informed consent needs to include consideration of the destabilizing effects of ontological shock, including the potential distressing shifts in worldview. Before someone embarks on a psychedelic experience, it's important that they feel that they have a toolkit of resources in place to support themselves, as well as access to external support. The latter might include an understanding community, as well as knowledge of available specialist therapists and medical professionals. In terms of aftercare, a focus on grounding, individuals may feel ungrounded and stuck in their heads. Bodywork and attention-focused practices can aid embodiment and counteract obsessive cognitive preoccupations. And then allow time to process. Avoid embedding the experience at a highly stressful time or when there are responsibilities to attend to directly following the experience. And then, if you're a healthcare practitioner, medical professional, or a peer that wants to support someone experiencing distress after an ontologically challenging experience with psychedelics, we could keep in mind that individuals may be struggling with making sense and seeking to adopt new frameworks. So be mindful not to exert undue influence in trying to explain their experience. But also try not to dismiss unusual content and spiritual framings as pathological, further alienating them. And avoid spiritualizing language unless the individual is choosing this as their own framing. And we also need to be able to help normalize the experience, referencing examples of yourself or others that overcame similar difficulties can help normalize the experience. So emphasize that there is a way through the difficulties so we can diffuse the sense of no exit, the fried my brain narratives. Also, we can support these people in reaching out to trusted close others and developing community of people who understand the potential challenges of psychedelic experiences and can offer non-judgmental support. So the preprint of this interview study has now been released this week, and if you want to, you can take a photo and find like the full findings there. We also report on what people find both helpful and unhelpful. Yeah. And then to sum up and leave some seeds for reflection, what we're trying to do is build a psychedelic safety net. So this involves learning about psychedelic harms and harm reduction, communicating this information better to the field and to wider society, and supporting those that experience these difficulties. So promoting psychedelics without having a safety net might arguably be both unethical and unsustainable. So something to think about. What elements do you feel are needed for a good psychedelic safety net? And this QR will take you to the project page, the Challenging Psychedelic Experiences project, where you can also find other links to our research. And also to say a big thank you to everyone that helps move this project forward. Both our funders, the William J. Nass Foundation, the Talman family, and other generous donors that wish to remain anonymous, the researchers on the project, and our participants. And a big thank you to Horizons and to all of you today for your interest on this topic. Questions are welcome.
Eirini, Argyri. Good questions here on Slido. I'm happy to ask a few of you. The first question, which is the most upvotes, is if you collected any data about whether people were also undergoing psychotherapy or had a therapist during the time of their extended difficulties. Did you look at that at all?
So we didn't ask this question on the survey. In terms of like their actual like open-ended responses, we did see that many even were having facilitated sessions at the time of the difficult trip, so difficulties still occurred then. And then in terms of like the element of helpful support from others, like as I mentioned, so as many people as they said that they did find that support from others helpful, including their therapists and guides, just as many said that actually that was not helpful for them, whether it was medicalizing, whether it was spiritualizing, oh, you just need to trust the medicine. And we do have some accounts of people that said they went back to their retreat facilitators, and some of them were told, oh, it's because you're possessed, you just need to come back, take more medicine, and like we can exorcise this demon out of you. And the participants were obviously really terrified, but others might actually go back to this and they might end up in this loop. There's, of course, the big element there of like cult leaders and other challenges, but yeah.
Any signal that there's psychosis going on or mania going on? Did you get a sense of any of that? that psychedelics can trigger psychosis or mania in susceptible individuals?
For sure. I mean, I think there is a lot of evidence, not necessarily from our study, but yeah, we do know that psychedelics can trigger that. But I mean, there is also work coming out that suggests that psychedelics can also help some people with psychosis. So I think it's too early to tell. I know that lots of clinical trials use an exclusion criteria, trying to be safe as well. But there is more work that needs to be done, maybe from people that already have had these experiences.
Any insight into what increases the likelihood of extended difficulties or not? Are you uncovering what some of the risks may be?
Yeah, so there were the elements, yes, and our respondents did say that their childhood trauma, some felt that was linked, so we did actually explicitly ask them that, I think it was 40% that said they thought that would be related. We also saw that, yeah, it's potential AIDS, it's actually still debatable, but there is emerging evidence that younger people might be at higher risk. Yeah, integration, preparation, all these factors are, yeah, so many factors at play.
Excuse me. Any ideas about next steps for research and what you want to look at moving forward?
Yeah, I mean, I think, firstly, digging in further into these different kinds of difficulties that are poorly understood. Something that we didn't see as much in our sample, but it's obviously something that is coming out increasingly and in media and people that experience abuse in psychedelic settings. And I've been reflecting on this. I feel like the fact that we don't really see these participants in these studies might be related to the fact that when you have experienced, let's say, sexual abuse in these settings, you're not really going to want to stay involved in the psychedelic sphere. You might not be the person that, the researchers reach out to. So you might want to just cut all ties. So I don't think that not seeing high prevalence in these studies suggests that it's not actually prevalent. And I think that's something we do need to reflect on.
It's really important. Thank you very much for your presentation. I appreciate it, Eirini.